Hello, everyone. Welcome to tonight's live stream. We are live. What is going on, everybody? Come on in, come on in. As you're coming in, give me a hashtag live and also give me a hashtag let's go when you're coming in here to the live stream. Hope everyone is doing well. I'm getting everything set up here for everyone. Make sure we are live, we are crisp, we are good. And welcome tonight. We have Denise, hashtag inner circle. What's going on? We have Brianna present. We have Alicia. We have Sunny. We have our man Tamis. We have Samantha. We have Tyler. We have Selena. We have Brittany. We have Taylor on the live. Guys, welcome, welcome. We have Habone. Welcome, welcome. We have Boom Boom on the live. Welcome, welcome, welcome. Hope you all are doing well. We have James. We have Andre on the live. Give me a hashtag live and give me a hashtag let's go down below. Hope all you guys are doing well. We got Jennifer, Kayla, Sunny, James. Welcome. We got the YouTube fam and the Facebook fam here tonight. Hope you all are doing well. We're starting off with about 40 people on the live. Welcome, everybody. Hope you're doing well. We got Kayla, Sunny, Jennifer, Amale. Hey, hope you're doing well, my friend. Congrats on your success. We got Austin, Michael, Jennifer, Alex, Adam, Jonathan, Tamis. We have, hope I'm saying it right, Ken C, Daniel, Jesus, Nyla, Camilla, Maria. Hashtag live, hashtag let's go. We got about 58 people on the live now. Let's see if we can get over 60. We got Kinsey, we got Jonathan. All right, my friends, hope you're doing well. Let's dive into it. So, Elizabeth, Andre, Becca, Chase, what's up? Guys, tonight, we are going to go over cardiology, BLS to ALS. So tonight is a full lecture, cardiology, BLS to ALS. I made a post recently inside of one of the biggest Facebook groups, the NREMT Study group. And I asked, hey, what do you want to learn about the most? And I really tallied every single vote tally up. And the answer was cardiology, okay? We all know that National Registry has 5 main core sections, and they're pieced off, so it's really more than 5. It's really more than 5. But it has main core sections to it. We call it the core content around here, okay? And cardiology is one of those main sections you need to know. So tonight, I'm taking the top 3 questions that I get asked about BLS cardiology and the top 3 questions that I get asked about ALS cardiology. And guys, we reached over 60 on the live. Let's go. We're at 70 people on the live. Give me a hashtag live. Give me a hashtag let's go. Happy that you all are here. Let's dive into it. So before we get started, I do want to do one more thing. Just make sure everyone knows about this because this is the final chance. This is the last shot. Tomorrow night, okay, this is huge. Before we get into this, tomorrow night, my friends, Sunday, August 16th, I am giving away a $600 student grant. Plus, right over there, our friend Tacky, I'm going to go over here. He's got it. This Littman Cardiology 4 right here. I'm giving this away in our second ever $600 student grant. I'm giving this away tomorrow night, Sunday. The EMS study party live tomorrow starts at 7:30 Eastern. You need to be there. You got to be there. Now, if you win and you're not there, it's okay. It's not going to anything wrong. You're going to see the notifications and I'll reach out to you. All good, okay? But I have a very, very, very huge announcement tomorrow night at 7:30. Well, probably one of the biggest announcements, something I've been working on for a long time, and it's finally came together, and I want to share it with you. 7:30, be there live, okay? A little bit after that, at 8 o'clock, is going to be the major announcement of the giveaway winner. But you got to be there live at 7:30 Eastern. You got a major announcement that's going to change the game as far as EMTs, advanced EMTs, paramedics, getting ready for school, getting prepped for school. You're my people, you're my family here. I give you a little teaser there, but you'll see tomorrow what it is. I'll leave it at this. You're gonna absolutely love it. You're gonna absolutely love it. You're gonna want to be there at 7:30 on the live. If you absolutely can't make it, like you're on a call or something crazy, it's okay. You could be the replay fan, but you're going to want to be there live. You'll see tomorrow, okay? This is being given away tomorrow, plus someone's winning $600. By the way, if you're new here and you're from TikTok or Instagram or Facebook or wherever, and you're on YouTube, we do monthly giveaways every single month with a paramedic coach. Could be money, could be EMS supplies, meaning money towards your schooling, right? Well, a lot of people that watch this, most of you are students of EMT, advanced EMT, paramedic, right? And I give away scopes. We've done 4 giveaways so far, so our 4th one, and we do one each month. So stay tuned to this channel. Make sure you subscribe on YouTube, The Paramedic Coach, and watch what we're doing there. I post content every single week on all my platforms, TikTok, Instagram, Facebook, YouTube. It's all there. Now let's go. Tonight, we got that out of the way. Big announcement tonight. Cardiology BLS to ALS. Here we go with BLS. Let's do it. Okay. I'm going to put Tacky back because it kind of fell over there. All right. All right. So there's 3 main things that people get messed up on with BLS. Okay. And guys, I'll do some shout outs later on, but I want to dive into tonight's lecture. So we're talking about cardiology BLS. There are 3 main things that people have a hard time with. And I'm going to tackle the first one here. People always ask me, Evan, when do I give aspirin? When do I give nitro? When do I give oxygen? And what's the order that I give it? Like, what should I do? Okay, I'm going to give you a scenario here of a patient. And we're going to use our brain. We're going to think about what aspirin does, what nitro does, what oxygen does, looking at the patient that we have. And we're going to decide what we should do first and what we should follow up with and how we do it, okay? Now, in most areas, you can give a patient oxygen, standing order as an EMT. You don't got to ask anyone for anything. You can do it. We all know that, okay? Aspirin, you don't got to, you just do it. Chest pain, aspirin. We're going to talk about it, okay? Now, nitroglycerin, that's a little different for EMTs. Okay, medics we know, and medics will learn from this as well, because I'm going to be talking about my mindset. If you're a medic watching right now, I know the ALS is going to come later, but this is going to be a mindset of what I think about. So this is going to be good for you as well, okay? Even BLS, okay? So we have oxygen, okay? We have aspirin, okay? And we have nitroglycerin. So the first thing that we got to know, okay, first off, these are all medications. These are all medications. These are all drugs. So remember that. You give someone oxygen, it's a medication, okay? Now, here we go. First, I need to define these. Then we're going to go over a scenario and what you do first and how you act, okay? Here we go. Now, oxygen. When we're talking about oxygen, the only reason why we give a patient oxygen is when they need more oxygen. That's it. Now, people try to overcomplicate things. It's very simple. Our goal, as far as oxygen therapy and administration, is to keep the patient between 94 and 99. Now, if you show up and someone's naturally at 100 as an adult, kind of rare. Usually it's 99, okay? But it can happen, okay? You might see a pediatric at 100. It's possible, okay? But really the goal, okay, is 94 to 99%. We want to keep them in that range, which is their normal range, okay? Now remember, as a quick pearl with our oxygen, with a COPD patient, our goal, it's kind of like a diabetic patient. The goal is just to keep them where they normally are, okay? If they're normally 94, give them 94. I bring that up. I know it's not cardiology, but that's when we talk about using oxygen. This is cardiology, these meds, okay? We're going to go over that, okay? So that's the only reason we're giving oxygen. We don't give oxygen just because you're short of breath. We don't give oxygen just because you have this or that. We give oxygen to patients to raise their pulse oximetry up to a good level. It just happens to be that most of the time when people are having real emergencies, their pulse ox isn't very good. So we give oxygen. Does that make sense? Okay, good. Okay, now think about it. a patient on home oxygen, what that means is normally their O2 levels, if they didn't have the supplemental O2, they wouldn't be able to live very long. That's why they're on it every day, okay? All right, good, good. That's O2, okay? Now, aspirin. I made a big TikTok on this today and an Instagram post. And I talked about, it's very simple, okay? Aspirin, the drug aspirin, does not, it's not an anticoagulant medication. It's not a blood thinner. It's an anti-platelet aggregator. Now, what does that mean? Very simple, okay? I'm going to draw it out for you, okay? This right here, my friends, is why when you're an EMT or a medic or whoever or somebody, anybody, if you think someone is having a heart attack and you give aspirin, you are literally saving their heart muscle time and you're saving them, potentially saving their life. I'm saying right here, okay? Here is why. I'm going to show you. Here is an example of, let's say, a coronary artery. An artery that supplies blood to keep the heart muscle alive, right? So there's coronary arteries, that keeps, the heart is a muscle, right? That muscle. So we got to keep the heart alive. The coronary arteries supply blood to keep the heart alive. If they get blocked, if the coronary artery gets blocked, what happens? We have a heart attack. That's a myocardial infarction. What that means, myo is muscle. Cardial, think cardiac. You know it's the heart. Infarction means death of, okay? Just, you could say destruction. I mean, it's not really technically correct, but I think of it death or destruction of what we're talking about, okay? So myocardial infarction is the heart muscle is dead or dying, okay? Is that fair? Okay. Now, if I have a clot here, and this is what aspirin does. If I have a clot right here, and what is a clot? Well, it's basically plaque or platelets that are sticking together, causing a clot inside those coronary arteries, remember, that supply blood to the heart to keep the heart alive. Okay? Now, when I give aspirin, I don't thin the blood. I don't change the way of constricting or opening up the blood vessel. No, I don't do that. What I do is I affect the platelets sticking to the clot that's already there, okay? So what that means is this, look, if a platelet's coming along, if we give aspirin, the clot right there, it will not get worse. Now that's the way that I think about aspirin. It doesn't thin your blood. What it does, what's the proper term? Anti-platelet aggregation. It stops the platelets from sticking together, which is the problem right here that we're having. That's aspirin, okay? So that's why it saves lives, and that's why the dose, 81 milligram baby aspirin, okay? They chew it up, 324 milligrams orally, that is the dose. Now, who does not get aspirin? If you call 911, okay, think about this. You're watching this right now. We got about 70 people on the live right now. Let me ask you a question right now. Who, right now, if you've ever had a call, like how many times do you call 911 in your life? Probably either maybe once, twice, or probably most of you never even called 911. So I want you to really think about this. Somebody in your community calls 911, not even drive themselves to the hospital. They needed to call an ambulance. And now you're being called. And they have chest pain and shortness of breath and nausea, vomiting. When I say who does not get aspirin, when I say who does not get aspirin, in that setting, in that place, everybody gets aspirin unless they are literally allergic or don't have teeth to chew the aspirin up. That's it. Okay, we gotta chew the baby aspirin, obviously. We gotta chew it up. Okay, that's it. Everybody else is gonna get it. Now, I'm going to say one thing here because I want to be clear on something with aspirin. I'm going to talk about it. Let's talk about this, okay? Is when we're talking about aspirin, okay, and we're talking about what it does, okay? The most important thing that I want you to remember is, yes, one of the contraindications is a GI bleed. But guys, we are not cookbooks, okay? We're not robots. We use our head, okay? If someone has chest pain and they're vomiting up bright red blood, think about it. What is that going to be? That's going to be like a esophageal varices or something like that, right? It's not going to be a heart attack. You don't vomit up red blood when you're having a heart attack, right? Right. Okay. You don't vomit up bright red blood. It's a different thing. You feel me? Okay. Now we're going to talk about these things. Okay. So stay tuned. Okay. Now, next thing I want to talk about here is nitroglycerin. We all know the dose. 0.4 under the tongue. We got all that. Okay. Now, what does nitro do? Okay. Nitro decreases preload, okay, which is the most important thing that it does, okay? That flow of blood returning back to the heart, okay? It decreases preload inside the chambers. That's number one, okay? Now, what does that really do as well, nitro? It's going to vasodilate. So this is the drug that's going to go to the coronary arteries that may be like this, okay? Maybe like this. Hey, medics, you know about that Prinz metal angina, that Prinz metal event? Medics, what is a Prinz metal angina? Well, here's what it is. It's not a clot, okay? It's not a clot that's causing the heart attack. It's usually induced from stress, and it's the coronary artery basically spasming, constricting so much that it blocks off, of the artery. Nitro helps solve that instantly almost. Okay, so that's why we give nitro. It's going to open it up. It's not a clot here. Instead of going here like this, let's say here's the clot. I'm going to be like this. Wow, I got way more room now to go by. This is the way, at a basic level, you should understand how nitro works and how aspirin works. If you remember this is our first one. If you remember this simple thing here, you're going to be golden. There it is. Okay? So that's our first thing about, we got to understand these three things here if we're going to be a great EMT. And number one. Okay? Great. Now, here's the next thing that I want you to think about. Okay? Now, I want to talk about, with cardiology, okay, we're going to move into number 2 now. We're going to talk about, for lack of a better word, the main signs and symptoms of different things that you may see in cardiology so you can understand it, okay? Now, technically, I said this is BLS, okay? We're going to go over it. This is what the National Registry, but everyone can learn from it. Even medics can learn from this as well, okay? Because it's all medicine here, okay? And really just patient assessment, okay? Is the whole test of National Registry, what it's going to do, it's going to give you a long scenario with vitals, with the name, where the patient is, what the weather looks like, all these things. And then right in the middle, it's going to give you the hallmark or the main sign and symptom right in the middle of the paragraph. And if you know that, the questions come easy. Just like I talk about with my course and my program. This is why my course is 100% video-based with a community with Q&A. The community and Q&A fills in the gaps. The videos go over all the core content, and that's how so many of my students are passing, because they understand the signs and symptoms, they understand the core content of what it is, and that is how you pass. The questions come easy. That's how we call it passing on easy mode, okay? Hard test, nervous test, but you get through it, and that's the goal, and that's what I do here, okay? Now let's talk about signs. Number 2, signs and symptoms. Here we go. Give me a hashtag live. Give me a hashtag let's go. Guys, we are 24 hours away. This is like our pre-party to the big EMS party tomorrow that we're having, EMS study party. Tomorrow, we're going to be doing scenarios. We're going to be doing some games. All lecture on cardiology tonight. Hope you're enjoying this. Let's do it. So I want to talk about a few things here. Is that okay? All right, cool. Let's do it. So let's talk about a few things. We're going to talk about CHF, okay? Okay, we're going to talk about that. We're going to talk about MI as well. Some MI tips. We're going to talk about that, okay? Is it cardiology? I would say it is. And I feel like so many people don't know about this, so I want to bring it up. I do want to bring this up, okay? We're going to bring this up, okay? PE. Again, I'm going through the most common questions that I get. I get a ton of questions on Messenger every single day. Could be either in my support email, in my community group. I've dived through those messages and ciphered in the most common 3 things. So we went through oxygen, aspirin, nitro. Now let's just touch on some of these things. Hallmark signs and symptoms, okay? So here we go. So what we're going to talk about now is CHF, okay? You got to understand how CHF works as an EMT. Why? My friends, these are probably some of the most common patients that you're going to see in EMS right here. I would say not a week. Now, when you're working in EMS, not a week will go by if you're working in a decent call volume area. Not a week will go by as you do not have a chest pain or difficulty breathing patient. It'll happen almost every day in some areas and every week at least in most areas, okay? And by the way, congrats to all of you. We got about 77 people on the live. Much love. Thank you for tuning in. I really appreciate you guys. So congrats for tuning in and getting some next level stuff here. I got your back, okay? So CHF. So CHF, I want to draw a little diagram first so you understand it because you might not understand it, okay? So let's talk about it. So here I'm going to draw a circle, okay? And I'm going to draw a few things here. I'm going to make a circle. Here's your right atrium. Here's your right ventricle. Here's your left ventricle. Here's your left atrium, okay? I'm going to draw this out, okay? What this is basically a mini lesson I'm going to give you on heart blood flow. Because if you don't understand heart blood flow, you're never going to understand CHF. But right now, if you do not know this, in the next 2 minutes, you're going to become an expert as far as an EMT or medic in understanding heart blood flow, and you're never going to have to worry about it ever again. Hang with me. Let's do this, okay? And here we go. Right here we have our IVC, our SVC. I'm going to break it down for you, okay? Let me just draw a few more things. That give me 2 seconds. Got to draw a few more friends here, okay? Oh, it's beautiful. Okay, here we go. So, mini lesson, 3, 2, 1. Mini lesson. Let's go. Heart blood flow. We got to understand this before I can even talk to you about CHF. Okay? So here it is. Arteries. Okay, which is not an artery, but let me tell you this first. Arteries, for the most part, we talk about arteries, okay? I want you to remember this. Arteries go away. So there's an A in arteries and an A in the word away. So arteries go away from the heart. You'll see how it makes sense in a second. Hang with me, okay? Veins, or you think the venous system, goes towards the heart. So arteries away, veins go towards, okay? Remember that first. If you're writing notes down, remember that, okay? Now, we have an SVC and an IVC. What is that, okay? So the word superior in medicine means above vena cava. All that means is the venous. So it's part of the venous system, part of your vein system, however you want to say it, okay? You're just starting, and I remember how it is to be when I was a 19-year-old EMT. I'm always going to keep things simple here, okay? You need to get the first block down before you become this amazing, amazing expert. If we don't get our first block down, then we can't pass anything, okay? You with me? Okay. So, blood returns here from the venous system from the rest of the body. Blood from up here, blood from down here. Here's your heart, okay? As blood returns here, it goes in to the right atrium, okay? What's going to happen next is I want you to think about this. Think about the atria as being a little more weak than its friend, the ventricles, okay? So what the ventricles do is they pump blood to different areas. I want you to give the right ventricle a job and the left ventricle a job as well. Okay? All right, great. So now the right ventricle has a job, like I just told you. So the right atria goes, man, I'm just an atria. I'm too weak. I gotta pass this blood off to my stronger friend, the ventricles. So it does. And it passes the blood to the right ventricle. And the right ventricle has a job to do. And the job is to get blood that is deoxygenated. Doesn't have any oxygen yet. The blood needs oxygen. It already put it off before. Now we need more. So what are we going to do? We have a pathway here. The pulmonary artery. Wait a minute. Artery away. The pulmonary artery connects the right ventricle and the lungs. Is that correct? Yes, it is. Okay, here we go. We're going on a ride. When you think of the lungs, what is the first thing that you think about? Oxygen. There you go. Am I wrong? Right? Right. The lungs have the oxygen. Let's get some oxygen. Right ventricle, you did it. You got the oxygen. Now the right ventricle, you're all set. You're all set. You're done. Now we have this blood that's been oxygenated. What are we going to do with it now? The left ventricle has not done anything yet, and neither has the left atria. What if God made a pathway between the lungs and the left atria, and the left atria, because it's a little weaker, would pass that blood off to its friend, its stronger friend, the left ventricle. And then the left ventricle could pump blood to the rest of the body through the strongest part, the aorta. Wouldn't that be awesome? That's what happens. You with me? Now, you with me? Good. Now, hear me out. We get the oxygenated blood, left atria, I'm too weak. Passes the ventricles. The ventricles got a job to do. Pumps it around, pumps it up. That's how you do it. That is heart blood flow. That is heart blood flow. Okay? Now, that was a little mini lesson, a little bonus, okay, for my EMTs. Now, if you know this going into EMT school, you're going to be so much farther. I wish I had I wish I had something like this to wake me up, to get me ready, to get me prepped, to shake me up and say, hey, man, you got to prep for EMT school or medic school. It's super accelerated, man. Get the prep work in. Watch these lives. Watch this content. And believe me, this is what is going to get you ahead in school. And congrats to all 72 of you that are on this live. Let's go. Give me a hashtag, let's go. You guys are awesome. On Saturday night with me, going over this stuff? Come on, guys. You guys are dedicated and motivated and driven individuals. Congrats to you. Let's do this. Okay? Now, when we talk about CHF, okay, I want you to think of one phrase, if you will, with CHF. Blood. It's the easiest way to remember it, and this is how I never forget it, okay? No matter how busy I am, how I never forget it. Blood backs up. Blood backs up. So what happens is, think about it. If I have left-sided heart failure, where's the blood going to go? Here it goes. Right into the lungs, and that's going to cause pulmonary edema, okay? At the EMT level, I know there's other things that can cause pulmonary edema. Well aware of that, my friends, okay? But we're at the EMT level right now. And the most common thing you're going to see is going to cause pulmonary edema is CHF, okay? Left-sided heart failure causes pulmonary edema. Think about it. This left side fails, or there's a bunch of blood here. Where's it going to go? Whoop, backs up. Okay? What about right side heart failure? Well, if the right side fails, what is right before the right side of the heart? The venous system is right before the right atria. Blood backs up. right? Right? So where's the blood going to go? JVD. My friends, this is why we see stuff like JVD. This is why we see stuff like pedal edema. Okay, edema in could be your calf, usually like a pedal, your feet down there in CHF. There it is. Now we get that. Great. Now we understand it. Great. Now we get the why. Great. But what does it look like now? I think you know it, but I'm going to tell you either way. Okay? So I'm going to erase this. Remember, it's a replay, so you're good. Okay? And by the way, if you're somebody right now, and we're going to talk more about this tomorrow, but if you're somebody who is getting ready for EMT school, that 5-minute lesson right there just saved you hours of worry. Because EMT and medic school, my friends, now I can snap right. There it is. EMT and medic school goes by like this. It's one of the most accelerated schools out there. By the way, anything you do in medicine is hyper accelerated, which is why you gotta prep first. But no one tells you to do that. They just tell you, hey man, EMT class, show right up. Advanced EMT, oh yeah, you're an EMT, show right up, man. Oh yeah, we do a super accelerated program. Paramedic school, oh, we cut it down to like 12 months, man. 8 months online. Come on, show up, brother. Or sister. And guess what happens? You're like, whoa, I'm swamped. I'm worried. If you're prepped first, and that's why I have my video study course. It goes through the prep of all levels, the schooling of all levels, the main core concepts of the schooling of all levels, and then National Registry prep, and you get access to me for one-time payment or lifetime access. The course is if you like this stuff, the course link is in the description. Okay, pretty cool. So signs and symptoms of CHF. Think about it. We have our edema, right? We have our JVD. We have our shortness of breath, right? That all makes sense now. We have high blood pressure, hypertension, right? Now what's the main one? What's the main one that they love to give people on exam to know if you know your stuff? Remember, it's not vomiting. It's not vomiting, okay? Vomiting, we're going to talk about other vomiting in a minute. But vomiting, think about it. Is that more lungs have a problem or more GI has a problem? Right. So if I have pulmonary edema and I have blood literally in my lungs, drowning myself, I'm going to be coughing up something. What am I coughing up? That is your pink, frothy sputum, okay? Sputum that is green and yellow, you think sick. What do you think of that color green? What do you think of? Green is kind of like sickly, right? Yellow and green, it's kind of sickly. That's what it is, an infection, okay? There it is, all right? Now, that is CHF. That is CHF, okay? Good. I don't want anyone leaving this live confused about this. And if you need to replay it over, because this is live and we move fast, it's okay. But I try to take my time here, okay? MI. Now, I just want to give you a pearl here. I want to give you a real tip here when it comes to MI patients. I'm just gonna put this all out here on the camera. Too much to write. I just wanted to tell this to you right here. Okay, here it is. My friends, my EMS family here on YouTube and Facebook, I do not want you missing or getting burned. Please, please. I hope you can hear me on this, my friends. The stakes are too high. I do not want you to miss or get burned by an MI. I don't want you to be an EMT who's 30 minutes away from the hospital and think, oh, this guy's just sick. No big deal. And miss something. So first, I want to talk about what exactly are the main risk factors for having heart problems and what you should look out for when you're on scene. Number one. The first thing is you need to check the med list. Think about it. If your patient already has a history of high blood pressure, hypertension, what drugs? What drugs treat hypertension? ACE inhibitors, like, write this down if you're taking notes. Lisinopril, okay? Also known as Zestral, brand name. Most commonly as Lisinopril. What else? What else is very common? Atenolol. What else is very common? Metoprolol. Everyone fights about how to say that. That's the way I say it. Take it or leave it. Okay? What else? What else? Calcium channel blockers. Amlodipine. Amlodipine. Norvasc is the brand name. One of the most common things you'll see. Low pressor is the brand name for metoprolol. Okay? Well, now, what else on the med list might pique your interest? Is he having a heart problem? High cholesterol. Hey, do you know some of the high cholesterol meds? Do you know them? Lipitor, atorvastatin, atorvastatin. Okay, Lipitor. What else? Crestor. Okay. Give you a pearl here so you don't make a mistake with your patient, and you got to know this, okay? Any drug that's a beta blocker that treats high blood pressure ends in OLOL. Any drug that treats high cholesterol ends in statin, ST, statin. That's how you know it. That's how you get better at meds. It's not a rule. It doesn't happen in every med that this works. But in these two meds, it does work, okay? I hope that helps you to help your patient. Hey, what else? Family history and advanced age go together. So what I mean is, family history doesn't mean that someone had a heart attack when they're 80. Family history means that somebody young in the family, like under 40 years old, have a heart attack. And now there they are at 40 with chest pain calling 911. Okay? Advanced age, like, anything over, so say 40 years old, 50 years old, I'm going to look at that. Smoking. We all know how bad smoking is for the body. So chronic, long-term smoking, obviously. Now, what is the biggest giant elephant in the room is diabetes. Diabetes, in my opinion, okay, everyone has their own opinion. There's no rule books here, guys. We practice medicine. Okay, everybody here. Diabetes, okay, is literally, in my opinion, the number one risk factor for having cardiac problems. Diabetes. Smoking, age, diabetes, high blood pressure, high cholesterol, family history. There it is. That's the med list. That's the history side. Perk your ears up. I want to give you some sneaky patients with MI when you're out there in the field. Now, here's classic. Classic is pain going down my left arm, okay, up to my neck, in my jaw, crushing pain on my left side of my chest, and I can't breathe and I'm nauseous. You might get a patient, my friends, that is just nausea, vomiting, back pain that happened 20 minutes ago. Okay? If your vitals look sinister, they don't look right. Don't go, oh, well, there's no chest pain. It can't be a heart attack. No. Okay? And again, as you progress in your career, you're going to be able to spot these things, but I want to give you that pearl now. One of the biggest phrases that perks my ears up is this. The patient says, I just don't feel right, or I just don't feel like myself. That's why I called you. Okay? Or I'm so weak, I can't get out of bed. I don't know what it is. I'm so weak. And they're not going to talk this fast because they're having a problem breathing. Okay? They're going to be one or two word sentences. Okay? Yeah. Good. Now let's talk about PE. Okay? PE. Okay? So I want to, it's so important, and so many EMTs get messed up with this, with PE. Pulmonary embolism, okay? This has nothing to do with the bronchi tree, the bronchioles, the alveoli. It's got nothing Pulmonary embolism has nothing to do with the lungs. It's not bronchi. It's not wheezing. It's not upper airway stridor, guys. It's not, nope. It's not rail. It's not in the lungs. It's an artery problem. It's a blockage. Let me explain. Pulmonary embolism, what it is think about it. Every single part, if you will, in our body needs an artery to supply blood to it to make it alive. So the lungs, okay, has an artery that supplies blood flow to the lung tissue to make the lungs alive. If I block that down and a clot gets there, it's not a heart attack. That's a lung attack. So a stroke is a brain attack. The arteries that supply blood going to the brain get blocked or burst open. Okay? A heart attack was really two options. The clot or remember that Prinz metal, you can Google it if you're an EMT, if you don't know what it is, or if you're going to medical school, now you know it. Prinz metal angina, or they call it a Prinz metal event, is a type of coronary syndrome where the spasm just shuts. It's a constriction so bad it shuts it off. No plaque, constriction. Now back to pulmonary embolism. Pulmonary embolism has to do with a lung attack, a blockage of plaque in the actual arteries that supply blood to the lung. It's a lung attack. So that your lungs are dying. Think about it like this in a way. It basically is infarction of your lungs. Remember we talked about infarct? It's not, again, it's a way to think about it so you understand it, okay? The lungs are dying. The lung tissue's dying. Fair? Okay. Good. That's PE. Now, how are they going to present? Clear lung sounds. Why is that? Why are they going to present with clear lung sounds? Because it has nothing to do with the bronchi tree. It's got to do with, really, it's more of a, if you can think about it, it's more of a vessel issue. So you have clear lung sounds. They're going to be tachycardic and hypoxic. And what are the risk factors? Smoking. What else? Birth control. Why birth control? Birth control puts you in a hypercoagulable, which, whoa, crazy word, coagulable, all that means is that your body, so hypercoagulable, means your body is in a state where it's easier if you have a clot. If you're on birth control, your body is in a state where it's easier for you to have a clot. That's called a hypercoagulable state. Okay? Birth control. What else? A recent vascular surgery. That makes sense, right? Vascular surgery. What else? Plane rides, train rides, bus rides, bed rest. Okay? Anywhere where you are stagnant, any period, long period of, this is the word, medical word, stasis. So at rest means stasis. If I say, this patient's been in a long period of stasis, that means they haven't moved off that bed in a long time. Okay? Here it is. Here it is. Okay? So they're going to be tachy and hypoxic. And this is what you want to look at with this patient. Okay? Good. All right, so now, the last thing with the BLS, and then I'm going to move on to a few pearls with ALS, okay? So first, I'm going to do a few shout-outs here, and we're going to dive into it. Guys, we are live right now. Let's go. Hope you guys are doing well. Let me see what we got going on here. Okay, we got Joseph, Kenny, Joseph, Tamis, Julie, Ashley. We have, let me go. We got a lot of people on this live. Let's go, let's go, let's go, let's go. We got Hope. Hope, what's up? Jonathan. We got the Wingo. We got the Wingo monster on this live. Let's go, all right? We got Boom Boom on the live, Jonathan. We got Elizabeth. We got Easy Money Sniper on the live. We got Reginald on the live as well. We have Jonathan. We have Kenny. We have Hope, Elizabeth, Alex. We got Easy Money Sniper, Elizabeth, Jonathan, Joseph, Scott, John, Robert, Hope, Jonathan, Brandon, Jonathan, Hope, Joseph, Elizabeth, Kenny, Tamise, Hope. And we have, keep going, let's see if anybody new. We got Dan on the live. We got John. We got Jay. We got Chase. We got Robert. Guys, give me a hashtag live. Give me a hashtag let's go. By the way, guys, if you're on Facebook or you're on YouTube, can you please, if you like this content, hit the like button. Hit the like button if you're watching this on YouTube, okay? It helps the YouTube algorithm, helps me grow what I'm doing here. Thank you so much. If you're on Facebook, I want you to like or love this post, drop a comment, and give it a share. It helps my message get more people. My goal is for every single student that goes into an EMT class or paramedic school or advanced EMT school to know who I am so they get this content so they can pass, so they can go to national registry, and so they can pass and do what they love and get that job. Let's go. All right, guys, come on. Give me a hashtag, let's go. That is the mission of the paramedic coach right here. Let's go. Like, comment, share. Please like for the YouTube algorithm. Thank you so much, okay? We got Josephine, Jonathan, Jay. Jonathan, Jay said, told my classmates about you. Thank you. Joseph feels so confident learning from you. Thank you so much. Rebel Space, Wanda, Joe, Eliza, I'm going to share my classmates. Thank you so much. Much appreciated. Thank you so much. Jonathan, hit the like button. Thank you so much. Okay, let's go. Number 3 thing we got to talk about here with cardiology. Now, April, let's go. April, the OG. Let's go. All right, here we go. Now, what we're going to talk about next, we're talking about BLS cardiology. We're going to keep rolling on the live here. Keep rolling on this, okay? Quick review. Aspirin, oxygen, nitro. We talked about it, okay? Now, we really talk about cardiac and cardiology, different things that we might be out there. I want you to be aware of a few things, okay? As a provider in EMS, I want you to understand a few things here from BLS to ALS. So we're going to step in, okay, and we're going to do a transition move, okay, from BLS to ALS. This is going to be my third one. This is a common question I get when someone's trying to transition from BLS to ALS, okay? So let's talk about it. It's pretty simple, but I want to cover it here, okay? So the biggest thing that I've seen when someone is trying to transition or move in is really like the baseline understanding of like what they're looking at as far as an EKG on the monitor. Okay, when someone's trying to, we went over the little BLS, okay? So if we're going from BLS to ALS, okay, I want you to understand when you look at this heart monitor right here, when you look at this, I want you to understand what is going on with it. Have somewhat of an understanding of what's going on when you're with your medic partner, okay? So all I'm going to give you right now, my people, this is right in the middle of BLS and ALS. It's the transition. I want to get you to understand the basic thing you're looking at so you can help out your partner. Then we're going to dive into some more critical ALS stuff, okay? You ready? Let's go. Okay. Now, here we go. So people that are going to medic school and they're on the fence, maybe you've been in EMT and we're diving into ALS, I'm going to draw just the waves, the classic waves of an EKG so you understand what you're looking at. Maybe you're an EMT and you do a 12 lead and you print it out and transmit it. Wouldn't it be nice to maybe know what's going on? I'm going to give you just a basic lesson here, okay? Here it is. Now, this first line right here is called the isoelectric line. This line is so important because we base everything off this line right here. Okay? Got it. Now, there is either a positive deflection or a negative deflection. What that means is the little wave either points up or points down. Okay? So the first wave is called the P wave. We got to know what the name is, okay? This is called a hat. This is called a P wave. We got to know it, okay? So P wave. That's what it looks like. That is a P wave and what it looks like. Okay, I'm going to move this in a little closer. Okay. Good. Okay. This is a P wave. Now, the next section here is called the PR interval. Okay, it's a spot basically between our P wave going to the R wave, which I'm going to show you. Okay, now hang on. Okay, watch. I'm going to draw the whole thing out. Okay, I'm going to go through. This is what I call, for lack of a better word, transitional material. When EMTs want to learn more, or you're prepping for medic school, this in medic school is going to go by so quickly, so fast, it's going to make your head spin. And when I was in medic school, give you guys an idea. First semester, we had about 30 people. End of the semester, we had 14 people. This is back in 2012 when I went to medic class. But this is what happened because they didn't know this. They didn't prep. Okay, let me talk about it. So, P wave, Q wave, R wave, got your notebooks out, S wave, T wave, isoelectric line, isoelectric line. We have the PR interval. We have the ST segment. And this is going to move us in to ALS. We've got to move in transitionally, okay? So here we are. This is a normal EKG on a patient. This is a normal EKG, okay? That's what it looks like. Now, I know this might look a little wide to my medic friends, okay? But you get where I'm going, okay? This is a normal EKG, what it looks like, okay? Now, I just wanted you to understand so you can see what a normal one looks like. So you can understand it, just to draw it out for you. But now, I got to tell you what is what. What are we talking about here, okay? Here it is. So here's the heart, okay? And first, I'm going to draw it out simply, okay? Okay? We all know at the top of the heart is the atria. The bottom of the heart is the ventricles. We all agree? Yes or yes? Yes. Okay. So what do you think the electrical impulse of the heart is going to start from? It's going to start from the top of the heart. Yes or yes? Yes. Okay. So right here is something called the SA node. Right here, there are internodal pathways here. Can they go through? They actually, hit and touch both atria. Okay. This here is our AV node. It's gonna make sense in a second. Bear with me. This is the bundle of His. Again, I don't make the words up. I just learn them. Okay. So this here is our bundle branches. Maybe you heard of a bundle branch block. These are bundle branches. Let me get it here. There it is. And this down here is our Purkinje, something like that. Purkinje fibers. I'll put a P here. I definitely spelled that wrong for sure. Oh, I butchered that. That's okay. We get the point. We're good. Purkinje fibers. Okay? Now, right now, if you're just learning this, you're going, Evan, what did you just draw there? I'm going to explain. So the SA node, okay, a normal EKG, what it talks about is sinus rhythm. So when I say that patient is a normal sinus rhythm, they look like this. They look like that. Perfect. Okay? Now, wouldn't it make sense that at the beginning, the start of the heart is the sinus atrial node, the sinoatrial node? Wouldn't that make sense? SA node. Wouldn't that make sense? It sounds good. Well, guess what? Every single sinus rhythm that you can see starts from right here at the SA node. So any normal heart rate starts from here. Okay? Now, in the heart, there are three main, we call them pacemakers. Okay? So I want you to think about this. If you're a runner running a race, there's a person called a pacer. And what they do is they gauge the pace of the race. Okay? So I want you to think about the SA node, the AV node, and the ventricles as three main pacemakers of the heart. Whichever position, whichever pacemaker is leading the race, follow me here, hang with me, okay? Whichever pacemaker is the first one that fires, that's leading the charge of the EKG, that is the one who sets the heart rate. What that means is the SA node goes from 60 to 100. When you were in EMT school, my friends, you were taught that the normal adult heart rate is 60 to 100. If your patient has a normal sinus EKG, that means it's 60 to 100. That's where the normal pacemaker is coming from. Does that make sense? Okay. Now, what if your SA node fails? It drops the ball. It says, you know what? I don't want to go off today. I'm good. I'm tired. I don't want to work today. And what's if we cross it off? The AV node is the toll booth or the junction of the heart. Okay? What this means is the rate, because it's all the way down here, gets lower. Okay? So now we're down to basically 40 to 60 as the normal pacemaking rate of the AV node. Okay? Think about now for medics for review here, think about A and V. Okay? Atria, ventricle. Well, it's right in between the atria and the ventricle. How can you forget it? That's why we call it the toll booth of the heart. So if the SA node fails, the AV node picks up. Okay? Now, what if the SA node and the AV node say, you know what? I'm going to take off today. I'm done. I'm going to take off, man. I'm good. I'm going on vacation. And the ventricles say, well, I'm still here. I'm the good old ventricles. I'll take over. I'm going to take over as the start of our EKG. The rate is going to be 20 to 40. Okay. So what this means, again, my goal here with this right here, I'm not going to make you a master of the EKG on 1 10, 20-minute session here on EKGs. But what I am going to do, you got to keep watching. You got to watch over the content, and we'll get there. We'll get there. But what I hope I just did is give you an awareness of the content that you're going to be seeing and give you an understanding of when your medic prints out an EKG of what you are looking at. And there's one final piece I'm going to share with you, okay? What this means. When the SA node fires and when it's going off, the normal, the heart rate 60 to 100. When the AV node is leading the race or leading the charge, leading the pathway, it's 40 to 60. When the ventricles are leading, it's 20 to 40. What that means is a junctional rhythm, the normal rate of a junctional rhythm should be 40 to 60. This is a little review from medics. I'm just telling you so you have the awareness, okay? I know it's new for some of my BLS providers. I know it's new if you're getting ready for medic school. You should be a little uncomfortable right now. You should be a little, whoa. You should be. It's okay. This is your first time seeing it. Wait a minute. Is this the reason why I tell people to prep for medic school? Yes, it is. This is the exact reason why I tell people to prep for medic school, my friends. And here's why. This right now is a preview of what's ahead of you. This right now is a preview of me as your instructor lecturing in front of you in paramedic school. And guess what I would tell you right now? I would tell you that you have a test coming up, let's say on Monday, on Tuesday, on what I just showed you here. And then again and again and again and again and again. Every 2-3 days, I'm going to quiz and test you. That's paramedic school. And you just saw us for the first time. And you're doing all these other things in your life, like working and family and everything else. But what if you prepped? And what if you just kind of got an awareness of this right now? This is why I do what I do, number one. And number two, the real deal, the real stuff, if you will. That's why I've created my video course. All the prep work is in there. Make sense? Okay, there you go. Good stuff. Okay. Now, final piece is I gotta just tell you what these waves do. Okay. Now that you know this, the P wave represents the atria firing, meaning it's the atria's time to because they call it, a new word for you, depolarize. Depolarize. I think of it as the atria is firing. It's the atria's turn to go. Depolarization. Okay. The QRS complex, negative deflection Q, positive deflection R, negative deflection S. Okay. What that has to do with is the ventricles, right here. The ventricles, now it's their turn to go. It is their turn to fire. It is their turn to depolarize and go off. Okay? The T wave represents the ventricles relaxing, repolarizing is the word in medicine, okay? Going back to where they once were to get ready for the next contraction. And you might be saying, hey, is the atria like never relax? No. The QRS is so big, it hides the wave that would show the atria actually relaxing. They relax, don't worry, they relax, but you don't see the wave because it's hidden, okay? And all this PR interval is the time travel between the P wave and until we get to here. All the ST segment is the length of time that we travel from here to here, okay? You have now gained, if you're an EMT getting ready for medic school, first we started with the most common questions that I get for an EMT in EMT school. Now we said, okay, this is for an EMT getting ready for medic school. The most common thing an EMT getting ready for medic school asked me, and my third thing with BLS going to ALS, is this right here. There it is. Let's roll, okay? So give me a hashtag live. If you're on the live, give me a hashtag replay if you're on the replay fan, okay? Now, the last thing I want to go over is I want to give you a few pearls about ALS, okay? This is a little ALS. I want to give you one more thing that people talk about a lot. Here we go. Okay. So for my paramedics here on the live, again, I hope this live has served you well. I hope this live has served you well, okay? Now here's what we're going to talk about here, okay, is a few different things with a patient, okay? If you're in medic school, and right now, we are now entering, I'm in medic school, and I need help understanding. Welcome. Here we go. So if your patient, okay, has a flipped T wave, we're going to go a little bit, these are questions I get, common questions. If your patient has a flipped T wave, okay, the T wave is supposed to look like this. That's how it's supposed to look. And you get the EKG, and it looks like this. You go, what the hell is going on here? I want to get you to understand why it might be like that, okay? Now, here's the first thing I want you to know. Flipped T waves can appear on EKG. So now we understand that. Well, what does it mean? if we see a pattern of T wave inversion, excuse me, this is what it might be. Okay, now here it is. I'll give you a few things here. Okay, the first main thing that you got to think about is ischemia. Okay, so hear me out on this. Medics, ST segment depression on an EKG. Okay, let's say there's no elevation, there's no 2 up and 2 down, no 2 up and 2 down, just downs. There's multiple downs, or 1 down, or 2 downs. That may mean ischemia. What ischemia means is they're not having a full heart attack. Instead of a full blockage, it's like being choked, the artery. Or it's I would say it's probably the best way to say it, actually. I'll stick with that one. It's basically like the artery being choked, but they're still alive. Not a full occlusion where there's no blood flow at all. Does that make sense? Think about, to visualize it, think about like a river and a dam. The dam stops it. No more. We have damage back here. With a ischemic event, where we're just having ischemia, but not a full blockage, ischemia means we have little trickles coming through still. But there's a problem here. There's a percentage that's occluded, but not full yet. That's ischemia, okay? What else? What else? I'm just going to name a few off here for you guys, okay? So flipped T waves could also mean you have a pulmonary embolism going on. Okay? So these are 2 of the main things that I look at. If I think that someone is having a pulmonary embolism from exam, and then I do a 12-lead EKG and see that they have flipped T waves on EKG, lead 3, okay, then I'm going to be like, okay, it sounds like a PE to me, okay? So here are the big 2. Now, big question I get. What do I do? What do I do if I'm a paramedic? What do I do if I'm a paramedic and I'm out there taking care of patients and I get flipped T waves? My friends, you keep printing EKGs. You keep burning EKGs. That is what you do. Because a heart attack, a real Stemi, is going to evolve over time and get worse and worse and worse and worse. And this is what the evolution looks like. Okay? The evolution, here's the evolution of a heart attack. First thing we got to do, my friends, is we have to understand the contiguous leads. Who are friends? Then we're going to dive into the evolution of an MI. Okay, now here it is. Now, what the criteria is for somebody having a heart attack to review is that you must have 2, let me get in the camera here. Here we go. That's good. 2 up and 2 down. That's good. There we go. 2 up, 2 down. Okay. So 2 or more contiguous leads. Here we call that friends. Okay. Or 2 up and 2 down. Okay. That's an MI. Okay. So let's talk about it. So lead 1 is friends with lead AVL. 2, 3, and AVF, they are friends. AVR has no friends. V1 and V2 are friends. V3 and V4 are friends. V5 and V6, they are friends as well. Okay? Now, 1 AVL, look at the lateral wall. So does V5 and V6. They also look at the lateral wall. Okay? 2, 3, and AVF, they look at the inferior wall. Okay? V1, V2 are going to be your septal. So septal view or wall. V3, V4 anterior. Anterior. Okay? So, the lateral, think side. Inferior, think bottom. Okay? V1, V2, septal in front, kind of in the middle, the septum. V3, V4, front. V5, V6, lateral. Now, here is the pearl I'm going to give you. 2 up and 2 down. So if I have ST elevation in 1 AVL, and I have ST depression in 2 and 3, it's MI. Now, based on protocol, it usually says you need at least 2 full millimeters or 2 little boxes of elevation to call it, and to call the cath lab, to open the cath lab. Okay, and you need 2 up and 2 down. Okay, that's fair. That's correct. It's not wrong. Okay. So medics ask me all the time. I think I made a post in this earlier today. It was something along these lines. What do you do if you're not sure about the EKG? Maybe the elevation is just like 1 box, or maybe you have flip T waves, or maybe you have ST elevation in 1 and 3 and 1 and 3. It's all over the place. You're like, what is going on here? And it's a funky looking. What is going on? You keep printing, you keep burning off EKGs, because I'm going to show you right now the evolution of an MI. Let's do it. Okay. Here we go. So first thing that happens in MI is hyperacute T waves. Remember that in your notes. Hyperacute T waves. If you're watching this right now and you are getting ready for med school, my God, you are going to be so prepared, so ready to go. My goal is to give you an awareness level on this live right now. So when you walk in and the instructor you paid all these thousands of dollars for to go to medic school, okay? When he goes, or he or she goes over this, you're going to go, oh, I think I know this already. Oh my God, I do. Now when you get taught it in school, you really know it. Then when you get tested on it and you're in study groups, man, you're a killer. That's how you make school easy. Okay, here we go. Now, here's the evolution of an EKG. Here is the evolution of an MI. So we start off with hyperacute T waves. So basically, what they look like is like this. The T wave becomes giant, hyperacute, meaning it's just started out of nowhere, acute, and it's giant. It's as tall as a T wave. I mean, it's as tall as the QRS. Look at the T wave. Here's P, Q, R, S. It's as tall as the QRS complex, the T wave. Then what happens in the MI is you will probably get signs of ischemia. So you're probably going to get this. Here we go. Next, after that, you're going to get this. That is a sign of ischemia. What's another sign of ischemia? Here it comes. ST depression. ST segment depression. ST depression. Makes sense? Makes sense? Yeah. Okay. So here's our isoelectric line right here. The ST segment's all the way down there. Okay. Good. Now the next step is going to be elevation. Here it is. So now here's the line here. It's above this line here. You get that? Makes sense? Look here. Here's our isoelectric line right here. And here's the ST segment right here. See it? It's above that line. Look down here. There's the segment here. Look, it's below. So ST segment depression, sign of ischemia. So we go hyperacute T wave inversions, ST depression, elevations. Now I want to get, now on this topic, I get another burning question. I actually get 2 burning questions. These are my final 2 burning questions I'm going to go over right now. Remember, guys, I see everything you do. If you message me, if you email me, guys, I try to respond to at least everything within a few hours. Anybody, how the hell do you do that? Because I'm obsessed. I'm obsessed. I have a post over there that says obsessed. I'm obsessed about what I do as far as EMS education. Literally, I wake up in the morning, I think about you guys. I go to bed at night, I think about you guys. And not just Monday to Friday like a job. No. 7 days a week, give me a hashtag, let's go. That's how the paramedic coach does it, and that's how we do here. And by the way, guys, for the YouTube fam, thank you so much. We've just hit 9K subscribers. We're only 1,000 subscribers away from 10K on YouTube, a goal I've wanted to hit for a long time. So do me a favor. Facebook fam, you're here right now. Like, comment, and share this live if you thought it's helpful. If you're on YouTube, please smash that button for the YouTube algorithm so EMS family out there, they can see this content, okay? Hit that like button. Let's do it. Now, these are 2 things that people ask me all the time, and I'm going to get them off my chest right now, okay? Pericarditis, hyperkalemia. Here we go. It's a question I get so much. Evan, can you do a lesson on pericarditis? Can you talk about pericarditis? Absolutely. I'm going to do it right now. Let's roll. Okay. Evan, hyperkalemia. How do you tell the difference between hyperacute T waves and hyperkalemia? We're going to talk about it too. You ready to roll? Here we go. Okay. Now, if I have a patient that has chest pain and I'm doing my assessment on the patient, when I think of pericarditis, I think of a sharp pain. I also think of a patient that can't lie backwards. So when I get them on a stretcher, and if I lay them back, they go, ah. That is what I think about with pericarditis. I also think of a patient who may have infection. Did you know pericarditis could be, basically, itis is an inflammation or infection of. So it's an infection or inflammation of the pericardium. That's what pericarditis is. So they may even have a fever too. Make sense? Okay. That's pericarditis. Now, how does that look in cardiology? How does that look like on an EKG? Okay, now here it is. Okay, so Stemi is 2 up and 2 down. It makes sense. Okay. Shout out to my man John Belinsky for this one. You're the man. One of my greatest mentors, John Belinsky. Okay, thank you for this one. 2 up and 2 down is Stemi. Now this, everybody up, that is pericarditis. Okay, everybody up, that's pericarditis. Okay, it's ST elevation all over the place, and it doesn't make any sense. It's not 2 up and 2 down. It's everybody's up. Doesn't make any sense. That's why my biggest tip for any medic is keep burning EKGs. Go with your gut, and always be on the safe side. If you're not sure, call it in anyway. The doctor will never be mad at you for overdoing something. They will be mad at you, and the patient obviously won't like you very much if you undertreat. Not undertreat. Let me rephrase that. Basically, if you assess your patient and you think that, oh, this is nothing, like that we don't want to do. Okay, we always want to be hyper vigilant in EMS. Okay, good. Now, this is why we keep burning EKGs. Make sense? Okay. Now here's hyperkalemia. I'm going to draw a big one for you. Okay. This is going to be our last quick tip here on our cardiology section. I'm going to do some quick shout outs here before we leave, and then we are going to see you tomorrow for EMS study party live. Guys, do not forget, if you are on the live right now, give me a hashtag live and give me a hashtag let's go, everybody, in the comments right now. Guys, tomorrow night is our biggest EMS study party. It's going to be all games. We're going to have some mini games. We're going to have some scenarios. Hell, I might even whip out the old heart monitor. Who knows what's going to happen? I might even whip out the old heart monitor. Who knows? Who knows, guys? I might whip out the heart monitor. I might whip out mannequins. We might do. Who knows what we're going to get into tomorrow night? Okay, tomorrow night, 7:30 sharp at Sunday, August 16th, 7:30 p.m. live on Facebook, YouTube. I'm announcing the winner of that Ron Tacky's lap right there. It's been sitting there for about a month. Okay, we do giveaways here every single month, so make sure to hit like. Subscribe to the YouTube channel. Go on Facebook. Just go over to YouTube after. Hit the Paramedic Coach and subscribe. There's a ton of videos here. Okay, it's crazy amount of content. Go ahead and watch it. Tell a friend. Share this with your classmates. Every class has 20, 30 people in it. Share this with your class. If you're getting ahead, let them get ahead as well. Don't be selfish. All right. All right. Now, Hyperk. Hyperk. Hyperk on EKG, okay? And by the way, I even asked my mentor about this, okay? He's a PA. I asked him, hey, man, what's the difference about this? And he said, Evan, you just gotta keep printing EKGs. I said, really? Damn, okay. Well, I'm gonna tell you about what Hyperk looks like. Here we go. Now, I'm gonna show you here, okay? Hyperk starts off like this. It's where everyone gets confused. Remember, we do not just read EKGs and go, oh, I have the EKG, so I'm not even going to look at the patient. You always treat the patient first with their signs and symptoms, and then we look at the EKG to help us guide us. Okay? Right. So what this means is hyperkalemia has a large amount to do with their story. Okay, so here we go. Dialysis. Okay, thank you. So here we go. Now, this is what basically hyperkalemia look like from the beginning. Okay. Now it's a little off there, but basically is what it looks like. Okay. Again, hyperacute T waves. Q, R, S, P. Hey, by the way, can I give you a quick tip? I guess I gotta give it to you. If you're getting ready for med school right now, or you're an EMT that wants to learn more, every single call where, it's not like a critical, like they're being intubated, like that kind of like level of an emergency, but the patient maybe has chest pain, but they're awake and talking and the medic's doing an EKG, tell them to print out a rhythm strip for you and just start looking at the EKGs. Now you're just, oh, P wave, oh, a Q, oh, an R, an S, a T. Okay? So it starts off with hyperacute T waves. Now, here's the real thing that happens. My friends, what happens is when the potassium, hyperkalemia, too much potassium. I got too much potassium, okay? What happens is when the potassium level gets higher and higher and higher, the EKG changes. So we start off with a normal QRS, but a tall T wave. Then we go to a wide QRS with a tall T wave. So we go tall, wide. Where are we going next? Funky. What do you mean funky? You turn to this funky looking, weird looking wave. You can Google it to see what it really looks like. Okay, I'm gonna try my best to draw it out. Okay, I'm not an artist. Call it a sine wave. You hear what I was about to do there, right? I always call it a funky sine wave. That's what I always call it. I almost call it that, really. Let's call it a sine wave. Sine wave. It's funky. Okay? It looks kind of like, I always mess up, right? It's very odd. Google it after, sine wave. It's kind of like this. Looks very odd, okay? Even this could be flipped, whatever it is. It's a very weird looking wave. Something along the lines of that. And I would Google it. You'll see it. You go, whoa, my God, sine wave, sine. Sine. See it in real life, but essentially this is it, okay? So as the potassium gets higher and higher and higher, okay? As the potassium gets higher and higher and higher, we go from here to here to here. When you get an EKG on a test, I'm going to back this up. So when you get an EKG on a test, for example, right, and you're going over a scenario, hyperkalemia is most prominent in the story. So if I have a test question and I see hyperacute T waves and hyperacute T waves, one's hyperacute T waves from an MI, one is tall T waves, but they both look like the same. So the story in the question is going to tell me hyper-K versus MI. And your patient story in real life is going to tell you as well. Is that fair? Okay, guys, my friends, guys, if only you wish, I wish I could tell you, but I'm chock full of surprises in what I do here. I had so much cool stuff for you guys coming in the next few months. If you've just started EMT school or paramedic school, I say big congratulations. Welcome to the family here. If you're getting ready for national registry, or you're someone who's prepping for school, or someone in school right now, you're one of these three people, what I want you to do is I'm going to put the link here right on the chat. And the link is down below in the description, but I'll put it in the chat as well. Guys, join the program. I worked my butt off day and night to make this the #1 EMS prep program in the world. 3 types of people should go sign up right now if you haven't yet. I give you, it's not a monthly charge. This is lifetime access. I have 2 main goals with everything that I do. I'm going to share them with you right now. My friends, I remember, because I went through everything that you're trying to do right now, I've gone through it. Because I remember being a 19-year-old, and if you're on the live right now, I'm going to share you a little bit of my story so you understand. I remember being a 19-year-old EMT, going to EMT school, lost in life, having no direction in life, not knowing where I wanted to go. And now I end up in this EMT class. Hey, I'll try it out for 2 weeks. Well, 2 weeks later, I was absolutely hooked, and I'm looking at the paramedic / instructor of my program going, wow, that's the gentleman, that's the guy that I want to turn into. I want to be like that guy right there. And here we are. So I've been in your shoes. I get it. I remember being halfway through EMT school and being lost and knowing, damn, this is pretty hard. I've been there. I understand where you are right now. So with going through all of it myself, #1, and #2, understanding where you are right now. And I remember people looking and going, he's going to go to medic school. He doesn't even have a lot of experience. Maybe that's you right now, and you don't have a lot of experience, but you're trying to go to medic school. That was me too. But guess what I did? I recorded lectures. I sat in the front row. I became, just like I do with my craft here, I became obsessed with EMS and paramedic school. And I did it. And when I grew and I grew and I grew, and now I'm here as a paramedic coach. And you all can do it as well and achieve whatever you want to achieve in life. But what I do know is this. I've gone through it. I know what you need. And I've put in the work and put that into a program at prepareforems.com. The link is right there. It's in the description. It's all over my social media. You will see it. I give you lifetime access to over 160 videos, plus a community group where you can ask me direct questions, not some random staff or random people. Ask me direct questions about what you have going on, and basically have me in your pocket whenever you want. Okay, the program sells for $49, which is probably less than the last time you went to the grocery store, which is probably less than the last time you filled up your car, which is probably less than the last time you went on a date for 2 or got dinner yesterday. Why, with so much value, why is it priced at $49? Because I remember where you're at right now. I remember where you're at. I know where you're at right now. You need high-level education at a price that everyone can afford. Because I remember going to EMT and med school, and guys, I didn't have a lot of money when I was going through school. I was a student. I give you my best at a price that everyone could afford. My goal here as a paramedic coach is very simple. And I hope, and I thank you for helping me with this mission. My mission is simple. I want every single EMT, advanced EMT, and paramedic student in the world to see what we're doing here, so they don't fail like the thousands of people who have failed out of EMT, advanced EMT, or medic school. I want to increase pass rates, and I want to decrease failure rates. And the number one reason how I accomplish that is by prep. And the prep is in that program, and that prep is everything that I do here. My friends, get ready for tomorrow night. I'm going to leave you. Enjoy the rest of your Saturday night. Thank you so much for the kind words. Thank you so much for spreading the word about what I do. And congrats to the now over 1,000 or so people that have gotten access to my program. Thank you all. Much love. And hey, I'm going to see you tomorrow. We are giving away, Tacky's got it on his lap, $600 to one lucky student. But you got to be subscribed to the YouTube fam. Go do that now. And I'm giving away that limited cardiology 4-scope tomorrow night. My journey, my story, my life, I give back to you. Love you all. Good night. I'll see you tomorrow, 7:30. Big announcement, huge announcement before the giveaway. I do it for you. I'll see you there. Cheers.